So my name is Jeanne Masterson. I'm one of the clinical midwife specialists in perinatal mental health, and I work on the specialist perinatal mental health team here in the Rotunda. I'm one of 11 of us. There's two other mental health midwives that I work with, Louise and Ursula, and I suppose we would run daily clinics where we would meet with mums and during pregnancy and in the postnatal period and work with them to support them and to support their mental health needs during the pregnancy and the year after birth.
My name is Stephanie Fobo. I'm the social worker on the perinatal mental health team, and I provide counselling and emotional and practical support to women and their families.
I suppose pregnancy, it's such an exciting time, but it's quite a challenging time as well for so many women. There's so many changes going on in your body. Physically, there's huge physical changes going on, but also hormonally, there's massive hormonal shifts as well. And we do know that women can feel quite overwhelmed and quite emotional at times. They might be more prone to maybe crying at X Factor or a particular ad or something like that. But also, if you think about the physical changes that can happen, for some women they can be quite challenging. So if you think of the first trimester, a lot of women may experience some morning sickness, which doesn't obviously just happen in the morning. But for someone that's experiencing nausea a lot of the time, this can impact their emotions, how they're going to feel. Certainly as the pregnancy progresses in the third trimester, mums can experience difficulty with sleeping, discomfort, they're up a lot to go to the bathroom. That broken sleep again can impact on their emotions and how they're feeling. So there's plenty of reasons in pregnancy that this can happen. And I suppose the main thing is to recognise that it's so important to mind yourself and be kind to yourself, you know, and to realise that it's okay, you know, there are going to be times that you're going to be crying in pregnancy, and that's okay, just to let it out. But again, as Dr. Duffy has said and Dr. Doyle has said, that if this is something that is happening quite regularly and that you feel your emotions are impacting on your day-to-day functioning, you know, if you're crying a lot, feeling quite low in yourself, I would encourage you again to link in with us.
Yes, so it's very common to worry during the pregnancy or when you find out that you're pregnant. It's very common. You might worry about the changes to your role, becoming a mum. It's a big change. You might worry about having to give up work. Women often worry about changes to the relationship with their partner. They might worry about financial aspects, or they might worry about physical problems that they might have during the pregnancy. They might have a fear of the birth. So yeah, worry is very common, and what I would say is that try and maybe talk to somebody that you trust. Talk through your worries with that person. Might maybe write down some of the worries you have and then maybe discuss them with your midwife or with your GP. If the worries get too overwhelming and they take up a lot of your time and they might stop you from enjoying things, I would say it might be best maybe to link in with our perinatal mental health service, and we can talk through your worries with you and support you through this. Yes, so it's very important, I suppose, to eat a healthy and balanced diet. It's important to do the things that you enjoy. So find some time during the week where you plan things, activities that you enjoy. It's also very important, obviously, to stop drinking and smoking if that's something you do. And it's very important as well to gather support around you. So you might get some help in with practical things like housework or shopping or cooking. What can also be helpful is maybe to engage in some mindfulness and relaxation exercises. If you exercise, or if you have been exercising before you were pregnant, you might keep that up. Exercise is very important. You might talk to your midwife about what exercise is best to do during pregnancy. Walking or yoga, kind of gentle exercises. Regular sleep is also very important. And talking through your worries, I suppose, with your family, as I said, that would be helpful, or with your midwife.
So what I would say to you is congratulations first of all on your pregnancy, but also I would encourage someone that has had a previous traumatic delivery to try and link in with us as soon as possible. Certainly for women who have experienced a traumatic delivery, if it's something that they've dealt with or even haven't dealt with, even coming in to the hospital, coming back for their booking visit can be quite triggering, and certainly being asked lots of questions about their previous birth. So I would encourage mums to maybe link in with our service, whether it is with myself or one of my colleagues. We recently have started a birth trauma clinic as well. We would work, I suppose, quite closely with women who have experienced a previous traumatic delivery and have a lot of fear and anxiety about their birth and their delivery. And we would offer appointments where we would, I suppose, offer listening visits, non-directive counselling. We'd look at helping to develop some anxiety management techniques. And also usually what we often can do as well is to meet with a woman and her birth partner in the 3rd trimester as well, maybe to explore how to develop a postnatal plan in relation to her mental health, and looking at ways of maybe identifying some of the supports that can be put in place, how the partner can support mum, and even to discuss some of the emotional changes that happen after you have a baby, and then to also look at some of the symptoms of postnatal depression, to reiterate as well the supports that are available, and to encourage women to link in with us as soon as possible if they feel that they are struggling at all. So again, what I would say is certainly for some women, some women do develop a fear of having a baby, and there is a condition called tocophobia, and for some women this is a condition that they may have developed from when they were much younger, and if they've never had a baby, the term is called primary tocophobia. I would encourage women that if this is something that they're struggling with, to link in with their GPs and to seek more support on it. If someone is pregnant, and I suppose this is where we need a little bit more information in relation to this question, that if someone is pregnant and has that fear of delivery and fear of birth, and it could be their first baby, it could be as a result of a previous traumatic delivery, I would again encourage you to link in with our service. And certainly we offer lots of support and skills and techniques to help prepare you for delivery, to reduce that anxiety, and to help support you through your labour and your pregnancy and labour.